The patient with a tracheostomy tube has many care needs. Most important is the maintenance of airway patency. Other needs are preventing infection of either the airway or the stoma, providing some form of effective communication, and providing emotional support. This program will focus on the essentials of direct airway care, including cleaning and changing the inner cannula, caring for the stoma, changing the tracheostomy tube, and maintaining adequate cuff pressure. The patient with a tracheostomy has a surgically created opening through the neck into the trachea or windpipe, usually at the level of the second or third tracheal ring. The tracheostomy tube is placed through this opening directly into the trachea. When a tracheostomy tube is inserted, the upper airway system is bypassed, as are the functions of the upper airway system. These include warming, humidifying, and filtering inspired air. Mucus clearance is performed through the tracheostomy. In addition, the trachea is compromised by the surgical incision and the tracheostomy tube. The presence of the tracheostomy tube and a surgical incision can predispose the patient to respiratory tract and wound infections. Therefore, you should perform effective hand hygiene before and after providing patient care. Observe standard precautions to avoid contact with blood or potentially infected body fluids. Protective equipment such as gloves, gowns, masks, and protective eyewear should be used when there is a risk of bleeding or when secretions are present and there is an effective cough. Performing tracheostomy care requires the use of aseptic technique. Cleaning the inner cannula is generally performed every 8 hours. The inner cannula may be changed every 24 to 48 hours according to hospital policy. However, more frequent care may be necessary depending on the characteristics of the patient's secretions and/or the size of the tracheostomy tube. In most cases, the inner cannula is disposable. It is simply removed, discarded, and replaced with a new inner cannula. In other instances, the inner cannula may need to be removed and cleaned. Follow your institution's policies and the orders of the physician. Before you begin, inform the patient about the procedure. Gaining her cooperation will enhance the effectiveness of the procedure. In case of emergency, be sure a handheld resuscitation bag with mask is near the patient when providing any kind of tracheostomy care. Prior to cleaning or changing the inner cannula, decontaminate your hands and don appropriate personal protective equipment. Because tracheostomy care procedures may stimulate the cough reflex, personal protective equipment typically includes eye protection, a face mask, and gloves.